Hello, this is Irene Goyes. This is week 3 assignment talking about syndrome of inappropriate antidiuretic hormone, or also known as SIDH. We're going to talk about the causes, clinical manifestations, medications, interventions, and complications that you might see with SIADH. All right, so some of the causes can be from cancers, central nervous disorders, drug therapy, and miscellaneous conditions. More specifically, going into the cancers, you might see them in small cell lung cancers, pancreatic cancers, thyroid cancers, colorectal, or prostate cancers. Some of the CNS disorders can be brain tumors, any type of head trauma, or Guillain-Barré syndrome. Drug therapy is pertaining to certain medications that people may take on a daily basis. So those include opioids, SSRI antidepressants, oxytocin, or someone who might be taking Tegretol. Miscellaneous conditions include adrenal insufficiency, COPD, HIV, and lung diseases such as TB and pneumonia. Clinical manifestations, there's like 3 different stages. So in the beginning, they might complain of dyspnea upon exertion, thirst, and fatigue. Urine output might be decreased, and they might complain of weight gain due to the fluid retention due to those kidney tubules retaining the fluid there. Now, in the mild stage of SIDH, they might complain of muscle cramping, they might be irritable, or complain of a headache. In a more severe case, and severe meaning lower at least or lower than 120 milliequivalents per liter, they'll be complaining of vomiting, abdominal cramps, and twitching muscles. Now, if it's extremely severe, they will be swelling in the brain area or cerebral edema, and that could lead to confusion and lethargy and even seizures. So it's a pretty serious condition. The numbers can change rapidly, so this SIDH can be life-threatening. Medications to treat SIDH, currently there's no drug to specifically suppress ectopically produce ADH, but there is a medication by the name of D-mecloxylene. Now, this causes the renal tubules to develop resistance to the ADH, and so it will dilute the urine. And Lasix, that can also promote diuresis. And this one, the numbers would have to at least be at 125 milliequivalents per liter, just because we don't want to mess with the potassium levels. Now, in the more severe cases, again, anything at least or lower than 120 milliequivalents per liter. There might be IV fluids, 3% sodium. You don't want to increase too fast because it can produce permanent cell damage in the brain. So the range would need to be anywhere from 8 to 12 milliequivalents per day. All right, interventions. Unfortunately, the patient would need to be on fluid restrictions, so anywhere from 800 to 1,000 milliliters per day. If they're at 125 milliequivalents per liter, this will help them decrease in the weight. So to help with that, because they're probably going to be really thirsty, you want to make sure you provide oral care. So that includes mouth swabs. They can chew sugarless gum. You want to make sure they're weighing themselves if they're at home. If they're at the hospital, obviously you're going to be doing that for them. Make sure you educate same time, same clothes that they're weighing themselves. Vital signs, heart sounds, lung sounds, all of that. Also, if they are at that severe stage of SIADH, You're going to want to go ahead and initiate seizure precautions. You want to make sure the head of bed is flat or no higher than 10 degrees. This will increase the venous return to the heart and lowers the release of ADH. So that will help with those numbers. You want to make sure that you're repositioning the patient, make sure they're comfortable. You want to maintain their skin integrity and their range of motion. So mobility exercises might be something the nurse can help with as well. Complications, just from hyponatremia alone can cause acute kidney disease. This is impairing the tubular transport, and that might be something, it's acute, so it's something that can be reversed. However, like I said, this is a life-threatening disease, so if not caught in time, it could cause permanent damage also to the brain. And then that's and then also with the clinical manifestations I mentioned earlier, it causes cerebral edema, so obviously that endangers the brain itself. Going back to medications, there was something that I did forget about to mention that I found in research. It was from a while ago, but I didn't see any conflicting research more to date. But urea is also known to help with SIDH. And with urea, they can not put the patient on fluid restrictions, so that might help their comfort level. Like I said, I didn't find any conflicting new research. However, the research I did find was a little outdated. So, but I just wanted to mention that could be a possible medication that could be given during an SIDH. That is it for my video. Again, this is Irene Goyes, week 3.